Bad breath, also known as halitosis, is a condition in which unpleasant odor is expelled from the mouth. This condition causes anxiety or complex issues among those affected. Today on Sound Health, that is our focus. I'm Olasumbo. Welcome to the show. Still Sound Health on Lagos Television, and today we are looking at a common problem people try to shy away from. It's called mouth odor, also known as halitosis. And I have with me Dr. Lisa Usifo Zein, a senior registrar oral medicine, Lagos State University Teaching Hospital. Welcome to the show, doctor.
Thank you for having me.
All right, Dr. Usifo Zein is going to enlighten and give a perspective on halitosis. What causes halitosis, popularly called mouth odor, in this part of the world?
There are different causes of halitosis, but usually before we talk about the causes of halitosis, we like to talk about the types of halitosis. Halitosis means an unpleasant odor with expelled breath. There are other words for it, like you said, bad breath, oral malodor, we say fetor oris. But then when we are talking of halitosis, we classify it into genuine halitosis. Genuine or true halitosis is then classified into the physiological or the normal type, and then the pathological type. And then we also have what we call pseudo-halitosis, and then we have halitophobia. So when we're talking about the causes of halitosis, to go back to your earlier question, each of these types of halitosis have a particular mechanism of action, so a particular pathway, and so a particular cause.
Okay, can you quickly touch? Can you please quickly touch on the types of halitosis you just mentioned?
Okay. We have genuine halitosis. In this case, there is actually bad breath when the patient expels breath. In genuine halitosis, we have what we call physiological or transient or normal bad breath. What it means is that your breath is allowed to have a bit of an unpleasant odor sometimes for a transient or short period of time. When you wake up in the morning, what we popularly call morning breath, when you wake up in the morning, your mouth has been closed for 8-9 hours while you were sleeping. Your saliva flow has reduced. So of course there will be a small bit of an odor. But we call it transient because when you brush your teeth in the morning, the odor should abate. So it's physiological because it's normal. When you eat garlic, garlic goes into the bloodstream, is metabolized there, goes to the lungs, and then you expel it out. Until the garlic is totally expelled out, you should have a degree of bad breath, which is physiological. It shows your body is functioning normally. And then we have what we call pathological halitosis. It is the pathological type that we now divided into causes inside the mouth, the oral, and then causes outside the mouth, the extraoral. So the types inside the mouth, or the things inside the mouth that can cause halitosis, the most common cause is poor oral hygiene. We have what we call plaque, or usually if you take your finger and you scrape the surface of your teeth, there is this white, so it's a biofilm comprised of different types of bacteria which lives in our mouth normally. But then when it gets to pile up and build up, usually around the gums, at the back of the tongue, then we are supposed to take it off with toothbrushing and tongue cleaning and dental flossing. But when we do not do this, we have poor oral hygiene. So that's one cause. Another thing that can cause it is an oral infections, when you have sores in your mouth. Then we call some things plaque retentive factors. If you have a hole in a tooth, food gets stuck in there, bacteria acts on that tooth. Normal putrefaction, if you leave food in a bowl in your house, it will get rotten. So you have a cavity in your tooth, food gets stuck in there, and then you have bacteria acting on it, you expel bad air, which is bad breath. And then our diet also, people who eat a high protein diet, meat, cheese, milk products, eggs, beans, suya, barbecue, you know, the whole 9 yards. When it is that this protein gets in the mouth, it is metabolized into what is broken down into amino acids. These amino acids are then broken down into what we call volatile sulfur compounds. These are gases. So once you open your mouth, the gases need an escape route, so they come out. So our diet too. Then people, like we said earlier, garlic, onions, people who eat a lot of spicy foods, turmeric, and you know, all those spices. In our local, we have iru, so it has this, you know, yes. So our diet is also one of the things that can cause. Another cause of bad breath is when it is that we have maybe gum infections, or like I said earlier, oral ulcers. Then there are people who fast. When you fast, and then you have this fat is being broken down to ketones instead of sugar, so there is this breath that comes from that. And then also inside the mouth, you could have a filling, an improperly done filling. Some people wear dentures. You're supposed to not sleep with your dentures. You're supposed to take it out of your mouth, clean it. It should have its own special toothbrush. Clean it with a toothbrush, and then in the morning, after brushing your teeth, you brush it and then you wear it. But then when it's not properly cleaned, so the food that was eaten yesterday is stuck on the denture because the surfaces are really rough, and then we put it in our mouth. Like we said, there's bacteria in the mouth. It acts on the bacteria, and then we open our mouth and we exhale.
Could it be attributed to lifestyle, like smoking, or any health condition?
Said earlier, there are the oral causes of pathological halitosis and then the extra oral causes. So one of the oral causes, like you mentioned, is actually smoking, even alcohol. Smoking, because tobacco has its own particular odor, and then tobacco tends to dry the mouth. Remember why we have morning breath is that saliva is not moving around. As we're talking now, saliva is moving, and so we have tobacco also drying the mouth. So apart from the peculiar smell of tobacco, you also have that it reduces your saliva flow, so it causes dry mouth. Then also the extra oral causes of, you have systemic illnesses. You have causes, we divide those ones into the perioral. That means the areas around the mouth can actually cause bad breath to be expelled out of the mouth. You have the nose. People who have chronic sinusitis, catarrh. In small children, sometimes how we know that a child has maybe a small item like a wristwatch battery or something stuck in his nose is that he comes down with bad breath. So a foreign object lodged in the nose, and then in your throat you have your tonsils. There are some things at the back of the throat. Tonsillitis, tonsillar abscesses, and then your throat itself, you could have acid from your stomach coming up when the valve is weak, and so the door between the stomach and the esophagus is weak. So acid from the stomach escapes into the throat and comes out into the mouth. It's an acid, it will give up gas. So you open your mouth and it is expelled as bad breath. That's in gastroesophageal reflux disease. So people who, whenever you eat, you notice your food keeps coming up. People like that could come down with bad breath. Then systemic illnesses like liver disease, diabetes mellitus, kidney disease, chronic kidney disease, or end renal failure. In diseases, like I said, like in GERD, like in gastroesophageal reflux diseases, patients like this could actually have a form of, then some drugs, some medications that patients, for example, hypertensive patients, some of their drugs dry the mouth and causes bad breath. Some patients who take all these vitamin supplements, iron, ferrous sulfates, ferrous gluconates, it has a particular metallic odor that when you open your mouth, it's perceived as bad breath.
Okay, with all you just mentioned now, when do I need to see a doctor? Do I need to lose some sleep if I'm experiencing bad breath or halitosis?
You mentioned that halitosis is something we don't often talk about. It's a bit of a social taboo, you know. And the reason why, there is something called, one of the types of halitosis called halitophobia. They call it an irrational fear of halitosis, where it is that a dentist tells a patient, you do not have halitosis. We do all the possible treatments for halitosis, and the patient keeps saying, anytime I talk, people rub their nose, people close their nose, and I feel like I have halitosis. One of the reasons for that is that halitosis is not easy to self-diagnose. I can say if I have a headache. I can say if my tummy hurts. But when I have bad breath, I will not know. But you will know, and he will know. So I think that is the problem, or that is one of the issues with treating halitosis. So if somebody feels he or she has halitosis, first and first, ask someone you trust, a spouse, a friend, a relative. Does my mouth smell? When I talk to you, do you perceive an odor? But remember, there is a physiological type of halitosis where it is that you just ate something with iru or fada, you know, so your friend may say, yes, sometimes when you eat that. Then also, you can ask your friend a question like, when it is that we were in that place that day and I was talking and that woman shifted away, did you notice that my mouth was smelling? Because sometimes the social cues that people watch for halitosis are just other people adjusting themselves, and you feel they are reacting to you. So if someone feels they have halitosis, first and first, improve your oral hygiene. Brush twice a day, in the morning and in the evening.
In this part of the world, you hear people say, do not use fluoride toothpaste.
I do.
How true is that? I've heard it so many times. Do not use fluoride toothpaste.
Okay, I am very sure that the people that you are saying said this, none of them are dentists. Okay. None of them have ever gone to a dental surgery class, because the most protective mineral for teeth is fluoride. There is a way in which you can say if you have elevated sources of it. For example, in some places there's a lot of fluoride content in their water already. But this fluoride that we are using to clean our teeth, we're not taking it in. The only people who that danger is in children. So that's why they have their own special toothpaste where the fluoride is about 1/4 that of ours. Really, and then it's graduated. You see 1 to 3 years, 3 to 5 years. So really, you're spitting it out. And the best way to protect your teeth is to mechanically, with a toothbrush, clean, and then use a fluoride-containing toothpaste. Even if you have to use chewing stick, use it with a fluoride-containing toothpaste. And then there is what we call dental floss, which you're supposed to use to clean in between your teeth, because food gets stuck in there and bacteria acts on it and you have the smell. And so use your dental floss once a day. Avoid the use of toothpicks. Please avoid the use of toothpicks. It causes more damage than harm. Use dental floss instead. And then when you are brushing your teeth, bring out your tongue and clean your tongue, because that is where most of the odor-causing bacteria resides. Avoid alcohol-containing mouthwashes. If you check and the alcohol says 5% ethanol or anything that ends with "all," that is alcohol. Alcohol, like we said earlier, will dry the mouth. It will give you a transient when you put it in your mouth. Oh, it's minty, it's burning, my breath is fresh. 5 minutes later, your problem is back worse. Avoid alcohol-containing mouthwash. Visit your dentist at least twice a year, because if you have plaque retentive factors like cavities, or if you have impacted teeth, or if you just need a general cleaning, we should all clean, professional scaling and polishing at least once every year. It's your dentist that will tell you if you need that. So if you think you have halitosis, that would be the way to go.
Oftentimes you see people move around with gums, they suck on sweets, they suck on mint, they use oral perfume. Are these medically okay to use?
These are there are aids that are known to either prevent mouth odors or mask the bad breath. So, first of all, the first aid that we recognize is water. Keep hydrated. I think it's recommended about 4 liters a day. And water cannot be substituted by coffee or soft drinks or fruit juices. Or water in its pure form. And then we have sugar-free gum, especially people who are maybe they've been fasting or they've been quiet for a bit. You've been in your office, you haven't had any conversation, and then you want to come out and talk to somebody. So there are breath mints, there are sugar-free gum, which you can quickly pop in. When you're chewing gum, please, once the 5 minutes, once the sweetness, because it's sugar-free, but there's a sweetener in there. Once the sweetness goes, you take it out and you throw it away. Not that you will chew gum for 1 hour, 2 hours. And then water, breath mints, sugar-free gum, and things like that can actually help to remove that transient, the physiological from keeping quiet and reduce salivary flow, the physiological from not eating or from just eating, having a lunch that has an odoriferous substance before you go out to publicly talk to people. You just quickly pop.
If you just rinse your mouth before doing that.
Rinsing is also good because it helps to dislodge food particles and things from around your mouth. But then we like you to also drink water while you are rinsing, so you can drink some water, you can swish it around and yes.
You also have some people go as far as using liquid contents of battery, apple cider, all sorts, all in the name of maintaining good oral hygiene. What's your take on this?
Well, I know about battery water for dental pain. I don't know about, but anyway, battery water is acid. Apple cider vinegar. Even people who take a lot of, because there's this new craze of putting ACV apple cider vinegar in water or lemon and drinking it first thing in the morning. It's good to be healthy, but we should try to do that with a straw because you are eroding the protective layer of your teeth. That's your enamel. So that is first. And then secondly, battery water has a bit of an odor. I know that's one. So I think
first of all, even medically okay.
No, you are destroying your tooth, you are destroying your gums, you are destroying the surface of the inner surface of your cheeks, the surface of your tongue. Basically, you are destroying yourself, and you will still have halitosis.
Okay, thanks for the clarification. All right, I read somewhere that halitosis could also be associated with depression and symptoms of obsessive compulsive disorder. How true is this?
We talked majorly about the first type of halitosis, which is genuine halitosis, because that's why we are here. Why would you have halitosis, the real type? There are 2 other types of halitosis. What we call pseudo halitosis, in which the person comes in and maybe once 2 or 3 years ago he actually had some form of halitosis, but he has now cleaned and anyway, patient comes in and says my breath smells bad, but the doctor can't perceive anything. So what you do is you go ahead, tell the patient to improve oral hygiene, you clean, and the patient is convinced that yes, my breath now smells good. So that's pseudo halitosis. Then there's something called halitophobia, where it is that the patient believes, it's an irrational fear of halitosis, where the patient believes that he has halitosis, even after being subjective tests, objective tests, being treated by a dentist, being repeatedly told by a dentist and his relatives that he doesn't have halitosis. So we're not sure of which comes first. Sometimes the halitosis can cause depression, withdrawal, social anxiety. You have people feeling so bad about their halitosis that they don't want to go to school. They don't want to go for that meeting. They quit their job so they can stay inside and obsessively, like you said, OCD, brush their teeth 100 times a day. If somebody turns their head, oh, he perceived my breath. So you can actually have the halitosis causing that. And then you can actually have it the other way around, where somebody has depression, which is manifesting as a feeling of, I have halitosis.
Okay, regardless of the underlying condition, can it be prevented? Can the condition be prevented?
You have halitosis in diabetes mellitus. The patient has a problem with insulin, with sugar metabolism. So where it is that the patient's body doesn't break down sugars, the patient begins to break down fat. The end result of fat is a ketone, which comes out as what we call ketone breath. You know that a diabetic patient may come down with halitosis. How do you prevent this? A patient who knows he is diabetic will be more regular with his dental follow-ups and with his physician follow-ups too, because if your diabetes is well controlled, you will not have this poor healing in diabetes. They're prone to chronic inflammation and chronic gum infections. You will not have a gum infection. Your mouth will not have that odor. You will not have your fat being broken down to, because there's enough insulin in your body, so you will not have ketoacidosis. So where it is that there are conditions that are prone to have halitosis, if there is a co-management of the patient by both his dentist and his physician, and we know that, okay, this is the usual pathway. If we don't do this, the patient can come down with this. So it puts in, you are able to put in place those preventive measures because you already know. So if a patient comes in and says, oh, I have bad breath, as part of our history taking, we ask, are you diabetic? Are you hypertensive? Are you asthmatic? Okay, are you on any drugs for this? So if we know the drugs that you are taking for hypertension, we know that this drug can cause your mouth to be dry. So if we liaise with your physician and he says it has to be this medication, we can then say, okay, fine. Frequent sips of water to combat the halitosis that comes with the dryness from your medication. So even with an underlying condition, there are always ways to get around.
Okay, Dr. Usifo Zein, as we wrap up this segment, what are your final thoughts to viewers at home?
I would like to say that yes, halitosis is a social taboo, but it shouldn't be as heavy as it probably is for a lot of people. If we maintain oral hygiene, if we brush twice a day with a fluoride containing toothpaste, if we keep hydrated, if whenever we are brushing our teeth, we brush our tongue, if we use dental floss, if we try to see a dentist at least twice a year, then halitosis will not be, the fear of halitosis or actually having halitosis, because we all know somebody who has bad breath. It's very, very common. So that will not be as much of a societal issue and a societal problem as it is.
All right, thank you so much, Dr. Lisa, for shedding more light on bad breath, also known as halitosis.
Thank you for having me. It was a pleasure.
Okay, that has been Dr. Lisa Usifo Zein, a senior registrar, oral medicine, Lagos State University Teaching Hospital. Sound Health continues with trending and home essentials. Please stay with us. hydrated and maintaining good oral hygiene will keep halitosis, also known as bad breath, at bay. That ends Sound Health this week. For further inquiries, please send SMS to 08035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.